It's time once again for Mental Health Monday, brought to you by LSF Health Systems. And today we're looking back at mental health trends of 2024. So there are some topics we discussed during the Mental Health Monday this year. So let's welcome back Dr. Christine Caulfield. I always learn so much from you. So now we're going to kind of recap the whole year. It's quite a bit. So, we learned a lot this past year about how mental health affects our everyday lives, especially in the workplace. So what did 24 teach us about managing workplace burnout?
Well, we had a lot of workplace burnout this past year, and thankfully our companies that understand that, understand the importance of helping their employees with mental health challenges, brought in a lot of new services for them. For example, if they didn't have an employee assistance program, counseling for their employees, they brought a program in. They also encouraged them to take better care of themselves, offering flex time, 4-day work days for 4-day work weeks, for example. Flex time, working at home some of the time. So they were really mindful, more mindful than I've seen in the past.
That's good.
To really help their employees avoid burnout.
So we're working in the right direction. Okay, so the demand for mental health services surged in 24, prompting the expansion of teletherapy and mental health apps. So how did this year reshape our understanding of digital mental health tools and their role in care delivery?
Yes, well, it's been a very important year, especially for telehealth and the mental health apps. What we are very excited about is the federal government has extended their approval for the use of telehealth, especially for prescribing medications, such as medications for people that struggle with ADHD or opioid use disorder, so they don't have to come in person. They can get that help via telehealth. Also apps. People like the convenience of being at home, getting on their app, getting some help from Better Talk, Headspace, those kinds of apps. And so it's been a real surge in using devices, if you will, and video conferencing versus the in-person, because especially for rural areas, a lot of people have barriers. They have transportation barriers, they have childcare barriers, and so being able to be in the convenience of your living room and having a session with your therapist, it's the way to go.
I imagine self-consciousness too, right? So like some people, I would imagine they feel kind of weird about actually going to the office, and so this way they get to do it from the comfort of their own home. So I think that's really, really great. So, new research highlighted loneliness as a public health crisis this year. So what did we learn about the compounding effects of loneliness?
Boy, I'll tell you, loneliness is, the research shows that it is just as damaging to a person that is experiencing loneliness as if that person smoked 15 cigarettes a day.
Wow.
So the health effects on the immune system, on longevity are profound. What we're finding is we need social connection, and we need to reach out to those that are lonely, experiencing loneliness, and provide them with social support, whether that be through telehealth, specialized apps, but we need community because we are, what's the old saying, no man's an island.
That's right.
And so we need social connection, and when we don't have it, it's very harmful on our health.
Absolutely, absolutely. I mean, I can just say the week where I had to be really super quiet with the whole throat thing, it's weird.
It really is.
It takes its toll, and I really didn't give that enough credence, going into that. That was wild.
Yeah, and it really increases mental health challenges such as depression, anxiety. Some people, pick up, start drinking, use other drugs because they're
trying to cope,
so much in pain. Yes.
Thank you so very much. We have learned so much over the course of the year. If folks want to learn some more stuff, where do we send them?
Well, if you have questions or need referrals, you can call our Access to Care line at 1-877-229-9098, or you can tap into our website, lsfhealthsystems.org, for more information.
Doctor, thank you so very much. I really do appreciate it. Always good to see Dr. Christine Caulfield. Guys, stick around.